Hello everyone, welcome back to Sowkya Vision. Today we are going to discuss the ulnar nerve. In the last class we have completed radial nerve and medial nerve. Today we are going to complete the ulnar nerve. Yes, ulnar nerve is also a major branch of brachial plexus which is formed from the root C8 and T1 with the little contribution of C7. Yes, with the little contribution of C7. Ulnar nerve is formed from the root C8 T1 with a little contribution of C7. Yes, these three roots forming the ulnar nerve at the axillary region. On entering into the arm region, it is presented medial to the superior ulnar collateral artery. Superior ulnar collateral artery is the branch of brachial artery. See, this is a branch of brachial. This is a brachial artery, whereas this is a branch of brachial artery, that is superior ulnar collateral artery. These two together passes medial epicondyle, behind medial epicondyle. Yes, the ulnar nerve and superior ulnar collateral artery, which is the branch of brachial artery, together passes behind medial epicondyle. Yes, in the arm region, whereas the ulnar nerve is presented medial to the superior ulnar collateral artery. Now, when it is crossing medial epicondyle of lower end of the humerus, that gives branch to the elbow joint. Yes, when it is crossing, it it crosses between two heads of flexor carpi ulnaris. These two are the two heads of flexor carpi ulnaris. So when it is crossing, it crosses between two heads of the flexor carpi ulnaris by giving branch to the elbow joint and to the flexor carpi ulnaris. Yes, on crossing it gives branch to the elbow joint and muscular branch to the flexor carpi ulnaris. Yes, now it is crossing forearm. After crossing arm, it entering between two heads of the flexor carpi ulnaris. It is traveling, it is passing through between two heads and entering into flexor digitorum profundus. Yes, it is entered to flexor digitorum profundus, where it supplies medial half of the flexor digitorum profundus. Yes, it supplies medial half of flexor digitorum profundus. Before it is entering into the flexor digitorum profundus, it is going to give a branch, is known as palmar cutaneous branch. It is a palmar cutaneous branch. It is a sensory branch where it supplies skin over the hypothenar. That is, this is the thenar. Yes, this is a thenar space, this is the hypothenar space. So the palmar cutaneous branch of ulnar nerve is going to supply the skin over the hypothenar eminence. Yes, this is the thenar eminence and this is the hypothenar eminence. Yes, this branch, palmar cutaneous branch, is going to supply skin over the hypothenar eminence. Now, the main branch continues along with the ulnar artery. This is the ulnar artery. It is ulnar artery is presented lateral to the nerve. So, ulnar artery is presented laterally, whereas ulnar nerve is presented medially with respectively. Yes, the ulnar nerve on entering into the hand region crossing flexor retinaculum. Yes, flexor retinaculum. It is crossing flexor retinaculum. Where it is crossed, when it is crossing, it is divided into superficial branch and the deep branch. It is divided into superficial branch and the deep branch. While it is crossing, yes, it is crossing in between the pisiform and the hook of hamate. Yes, pisiform and the hamate bones. Before crossing the hook of hamate and the pisiform, it is dividing into superficial branch and the deep branch. Yes, the deep branch is crossing pisiform and between pisiform and hook of hamate under cover of pisohamate ligament. Yes, pisohamate ligament, it is a ligament that is extending between pisiform bone and the hook of hamate. These are the carpal bones. Yes, the superficial branch is going to supply to the palmaris brevis. Yes, superficial branch and deep branch. The superficial branch is going to supply palmaris brevis and it is continued to supply skin of the palmar surface of medial 1/3 of fingers. Yes, this is the medial part, right? This is the medial part. So it is going to supply the little finger and half of the ring finger. That too cutaneous part. Cutaneous. As I said, it is a sensory. So it supplies skin of palmar surface of the medial half of fingers. Now, this is the course of sensory. Now let's see the course of superficial branch. Now let's see the course of deep branch. After dividing into two branches, the deep branch entering through under pisohamate ligament and going across the palm region, supplying to adductor pollicis, and also deep part of flexor pollicis brevis, adductor pollicis and flexor pollicis brevis. When it is crossing the arm, it is going to give branches to flexor digiti minimi, abductor digiti minimi, and opponent's digiti minimi. Yes, it is when it is crossing the arm region, when it is going to cross the palm region, it is giving branches to flexor digiti minimi, abductor digiti minimi, opponent's digiti minimi, and also giving branches to 3 palmar interossei, 4 dorsal interossei, 2 medial lumbricals. Yes, it is going to give 3 palmar interossei, 4 dorsal interossei, 2 medial lumbricals. Yes, where it is going to give the branches after the deep branch of ulnar nerve is going to give adductor pollicis, deep part of flexor pollicis brevis, and branches to palmar interossei, dorsal interossei, and 2 medial lumbricals, and the branches to flexor digiti minimi, abductor digiti minimi, opponent's digiti minimi. This is the supply of deep, whereas supply of superficial is to palmaris brevis and skin over palmar surface of medial half fingers. Yes, once again, the ulnar nerve is formed from the roots C8 and T1 with the little contribution of C7. It is formed in the axillary region, crossing arm along with the superior ulnar artery, which is presented lateral to the ulnar nerve, which is a branch of brachial artery, crossing medial epicondyle posteriorly between two heads of flexor carpi ulnaris. When it is crossing the elbow joint, it gives articular branch to the elbow joint and supply to the flexor carpi ulnaris. When it is crossing through forearm, it gives a palmar cutaneous branch, which is a sensory branch, supplying skin over the hypothenar membrane, the hypothenar eminence. The main branch continuation along with the ulnar artery, whereas ulnar artery is presented lateral to the ulnar nerve. The ulnar nerve is dividing into superficial and deep branches before entering into the pisohamate ligament. The superficial branch is a sensory which supplies to the palmaris brevis and medial half of the fingers. And the deep branch crosses pisohamate ligament. Underneath the pisohamate ligament, going to supply adductor pollicis, deep part of flexor pollicis brevis. When it is crossing the palm region, it is going to give branches to the flexor digiti minimi, abductor digiti minimi, opponent's digiti minimi, and along with 3 palmar interossei, 4 dorsal interossei, 2 medial lumbricals. Yes, this is the course of superficial branch and the deep branch. Now, what is the motor supply? In conclusion, motor supply, it gives to flexor carpi ulnaris, medial half of flexor digitorum, profundus, adductor pollicis, flexor digiti minimi brevis, abductor digiti minimi, medial 2 lumbricals, interossei, dorsal and palmar interossei and dorsal interossei. Cutaneously sensory, it supplies to medial 1/3 of hand, little finger, and medial 1/2 of ring finger. It supplies 1/3 of hand, little finger, and medial half of ring finger. Yes, this is complete discussion of ulnar nerve. If you have any doubt, please comment in the comment section. Like the video, share the video with your friends, and subscribe to the channel. Namaste.